like medically speaking, what is the average male orgasm?
Like it's 5 to 7 minutes.
5 to 7 minutes?
Yeah.
Can you say that louder for everybody to hear?
It is 5 to 7 minutes.
5 to 7 minutes. And don't let anybody tell you different. All right? Everybody, 5 to 7 minutes. And that's fine. And that's enough.
And it's not too much either.
And it's not too much. What's going on, everybody? I'm JC Mendoza, and this is Uncomfortable Questions. With me today, as always, is board-certified urologist and SVP of Men's Sexual Health, Dr. Peter Stahl. It's good to have you. I have an uncomfortable question for you. Spoiler alert. I don't know if you saw that one coming because, you know, we have such a comfortable rapport, but I do have an uncomfortable question for you.
Okay, well, let's see if I get an answer.
I'm sure you will. My question is, why might someone have trouble ejaculating?
Oh, that's a great question.
Yeah.
So we're talking about delayed ejaculation.
Delayed ejaculation, which is like, I feel like we've talked about premature ejaculation at length, so I'm excited to hear the opposite end of that spectrum.
Yeah, totally, right? So there are a bunch of reasons why someone might have trouble reaching orgasm.
Right.
They range from psychological to behavioral to medical things like hormonal imbalances or medication side effects, and things like nerve problems, diabetes, loss of sensation. So those are some of the things that cause delayed ejaculation.
Delayed ejaculation, is that like the medical term for when somebody has trouble reaching orgasm?
Yeah, delayed ejaculation is the main term. You also hear delayed orgasm or in severe cases, anorgasmia. And this is a condition that can be present since the beginning of someone's sex life,
Right.
Which is called lifelong delayed ejaculation.
Right.
Or it can be something that develops later in life, triggered by something identifiable or not, and that's called acquired delayed ejaculation.
Okay.
So delayed ejaculation is a multifactorial type of condition. It can occur for a bunch of reasons. One of them is actually if you also have ED, because getting really hard erections is important for stimulating the nerves that are responsible for sexual excitement, arousal, and stimulation. And so sometimes ED can cause delayed ejaculation. There are also hormonal imbalances, medication side effects, some psychological or behavioral causes, right? So these vary from like the most sort of common and benign of these would be like someone who, when they're growing up, sort of discovers masturbation by like humping their sheets. Right?
Okay. I see.
But like at some point, if you get too used to that kind of stimulation, that's different than the stimulation that happens with a partner in a major way. And then there are, sometimes the use of pornography with circumstances that you're watching that are just not true to life can be sort of a part of that. But really any like really unusual way of masturbating that is not something you feel comfortable with a partner, or just something that's not like physically possible with a partner is idiosyncratic masturbation. And if you like program your body to require that to achieve an orgasm, and then you can't do that with somebody that you care about, you might have a problem.
Yeah, that you're almost setting the bar too high, like on your own.
I think you're just like playing a whole different game.
Yeah, that's
right?
true.
Like,
you have a whole nother set of games. There's cards, there's dice involved.
Right, yeah.
I could see how that would present like a delayed ejaculation.
Yeah, what else? What other causes? The other thing, medication side effects. That's a big one.
Okay.
And in particular, side effects of some of the psychiatry medicines that we use.
Okay, that's good. That I can see how. I feel like people who like suffer from premature ejaculation and then people who suffer from delayed ejaculation, I feel like we just got enough of them in a room together and have them meet in the middle somehow. I feel like that would be a really nice, just recalibrate. Like you take some of what I got, I take some of what you got, and then eventually everybody's happy.
I think that would be great if it were possible.
If it were possible. Yeah. That'd be nice.
Then there's like psychological stuff, right? So that means like performance anxiety.
Right.
Maybe someone is attracted to a different gendered person than, they're not out of the closet yet or whatever. And they're just not sexually attracted to the partners that they've been with. That's sort of a psychological behavioral issue that comes up sometimes.
So let's say somebody goes to their urologist and they get diagnosed with delayed ejaculation. What would be some treatment options for them?
Yeah, so it's really trying to address the underlying cause, right? So If you have ED, it's making sure you're on the right ED meds to maximize erection rigidity. If it's a medication side effect from like an SSRI for anxiety or depression, it's a dose reduction, a change, a collaborative discussion with the treating mental health care provider to try and find the sweet spot. If it's a hormonal imbalance, it's fixing that with medication to correct the hormonal imbalance. If it's idiosyncratic masturbation or other psychological things, it's working with a sex therapist and trying to kind of reset things. And if it's none of those things, there are some, empirical treatments that, occasionally work in some people, but sometimes it's just about, resetting expectations and trying to figure out behavioral ways to address this, right? So if you can't fix the fact that somebody requires intense, prolonged stimulation to have an orgasm, maybe you can, help them integrate like a vibrator into their sex life.
Compromise.
Or, not really. That could be like a real solution for people, right? But you got to treat each case individually and figure out what works. Sometimes we're really successful, and sometimes it's a pretty frustrating condition, unfortunately.
I could imagine. But what hasn't been frustrating is this conversation. I feel like every time we talk, we uncover more and more about the truths of these uncomfortable questions that we ask. We've talked about delayed ejaculate, DE. We've talked about ED. We've talked about PE. I'm here with DP, Dr. Pete. I'm JC Mendoza, your host for Uncomfortable Questions. This has been another stellar episode, Dr. Pete, if I may say so myself. There's no delay in my diagnosis of that. I've had a great time with you here.
Yeah, we knocked it out of the park, JC.
We did, and you guys knocked it out of the park by watching. Thank you so much. Please remember to like, subscribe, follow for more uncomfortable questions. I've been JC Mendoza. This is Dr. Pete. We'll catch you guys next time.